Well, welcome everyone. My name is Adam Cross. I'm a licensed marriage and family therapist in Southern California, also the founder of the Catholic Therapy Center. And today I have the privilege of being with Dr. Anthony Isacco. And anything you want to share with people about yourself, introduce yourself.
Well, Adam, thanks for having me on the podcast. I'm Dr. Anthony Isacco. I'm a professor, program director, and head of clinical research for the MS in Clinical Psychology program at St. Mary's University of Minnesota. And even though the school's in Minnesota, I'm a proud Pittsburgher, and that's where I live with my family. And so happy to be on the podcast and talk about psychology and integration and seminary formation. And I think we've got some good topics on tap.
Yeah, and we met briefly at the Catholic Psychotherapy Association's conference. I think it was 2 or 3 years ago now, in San Diego, in Old Town San Diego, which is awesome. So it's one of my favorite spots. Yeah.
Yeah, I'd been to San Diego a couple other times before, but never to O Town, and that was a nice treat, nice night out. I talk to my students all the time about the importance of going to conferences and networking, and you never know who you're going to meet and how they might be able to, be part of your professional network at whatever point in your kind of development. And this was a good example. We met, we talked for a little bit, and circle back to do the podcast together. So
Yeah. Awesome. Yeah. And thanks for, reaching out. And I think before we hit record too, we were mentioning that this is such like a niche area of just Catholic therapists, and even probably more niche in terms of programs, like integrating the faith into psychology and therapy. And while there's a lot of therapists out there, and even a lot of therapists who are Catholic, it's a much smaller circle when we look at like who's integrating, and then who's actually providing that framework in terms of education and degrees. And so I'd love to hear too, like, yeah, what you're doing with St. Mary's right now, which is awesome. I'm aware of only a few programs that are really doing this, so I'm excited to hear.
thanks for asking about it. So first of all, you have to give a little tip of the cap to our Protestant brothers and sisters. They're about 40 to 50 years ahead of us in terms of integration with counseling and psychology, both in terms of education, training, clinical practice, and research. And so, tip of the cap and a sign that it can be done. It is being done, and it works, and people are drawn to it. And it really wasn't until Divine Mercy University about 25 years ago that said, "Oh, well, if the Protestants can do it, why can't why can't the Catholics do it too?" And so my history is correct. Divine Mercy was really the first kind of Catholic graduate program to say we're going to explicitly integrate the Catholic faith with psychology and have a training program. So owe a lot to Divine Mercy for taking that brave step and trailblazing for us. And so that brings us basically to my program, the clinical psychology program at St. Mary's, which we're launching this year. We have our first group of students that is planning to start in September, so about a month from now. Modern psychology, there's tons of modern psychology programs out there, very similar in a lot of ways. Of course, you can get different unique niches here and there, depending. They're fairly similar in terms of having a bit of a arm's length or even adversive or sometimes even hostile relationship to religion and spirituality. And that can really, harm clients. It can leave blind spots, can leave a lot of people out there in terms of students who don't feel like they have a home or professional identity. And so we wanted to kind of step into that gap and say, Divine Mercy can't do it all, basically. We want to be part of the same family with Divine Mercy and offer really a faith integrated clinical psychology program.
That's awesome. Yeah. And I shared too, earlier. Yeah. My program, my master's program, it was, I don't know if it was explicitly discouraged. I won't say that, but it was not very encouraging or inspiring at the thought of bringing in the faith into the therapy process. And there was kind of more that like, hey, we need to be a blank slate, and not even that we're we can distinguish between like therapy and evangelization, but having that foundation and that anthropology and that approach, I think is so big, especially for people who are looking for healing and from a truly Catholic perspective. Like what is healing? What is the human person even? What does it mean to be human? Right? Like these are such basic questions. And so I think seeing what DMU has been able to offer, especially with the meta model and now what you're sharing too, I mean, that's huge. And I think there's such a need for that and more, more options with that too. So this is a master's in clinical psych and versus kind of maybe a master's in counseling. And so any key differences you're really honing in on there?
Yeah, so my degree is in counseling psychology, and I taught for 16 years in a counseling psychology program. And so I feel a little bit like I'm betraying my counseling psychology roots by going into the clinical psychology route. So there's like all these historical differences between clinical and counseling psychology. I used to teach a whole semester long class, actually, really differentiating between the two. If you look at counseling psychology these days, they're fairly on the kind of secular social justice advocacy kind of model right now. And so a lot of good with counseling psychology. I have no regrets about getting my degree, but I feel like it's kind of gone so far down a different track. I don't recognize a lot of counseling psychology now to the kind of the field that I entered into whenever I first started graduate school about 20 years ago now. I think clinical psychology has its roots more in like kind of the medical model, healthcare, and also like within that, like integration. Like if you're going to be a healthcare professional provider, you have to be kind of integrated. So I think I just saw a little bit more of an opening with clinical psychology to be integrative. And so I said, let's kind of explore that opening. Of course, there's a lot of overlap between the two. Both counseling and clinical psychology are considered health service psychology fields. And with that, people get like the same license, apply to the same jobs, etc., because of that overlap. But there are still some distinct differences which keep them distinct degrees.
And with this new program, it sounds like it's an online format. Are there any like in-person requirements? I know that's something people ask a lot about usually.
Yeah, so it's I'm calling it like 97% online, with traditional synchronous and asynchronous kind of course requirements. And then we have 2 in-person residencies in Minnesota, one at the beginning of a student's time in the program and one at the end of their time in the program as kind of bookends. And those residencies are what we're calling extended weekends. So Wednesday through Saturday, basically. We wanted to get the best of both worlds, like the online art is great. It really allows for the accessibility of the education and the training. And then being in psychology and counseling and clinical field, it's still very much an interpersonal and social field, right? And so to get some of that in-person community building and engagement, we thought was really important. So that's why we added in the residencies.
Yeah, I have a good friend who I also podcast with. His name is Josh Hernandez, and he just finished up at DMU. In his internship, or now that he's an associate, he's kind of taken on some admin roles, and he's working with trainees to kind of train them or get them set up with the clinic he's at. And he recently told me, he's like, I didn't realize how important those like residencies are and the in-person thing, the experiences are, because he's seeing other trainees who they haven't had like any type of in-person practice. And I think part of it's just that confidence level as a trainee where you're like, I need to just like gain some confidence, gain some hours in this. But he was reflecting on his time of just the little in-person. I think it was pretty similar. Like he went out a couple times a year for DMU, but he's just like, man, I am so grateful for that, because practicing in person with people was such a different feel, and it really helped me gain that confidence and experience. So I think that's a great element. I know sometimes people are like, oh, I don't want to have to travel. I could do something totally online. I think, from what I've heard, it makes a huge difference.
Yeah, I get asked all the time, like, well, what's better, like online education or clinical work, or what's better, versus in-person education or clinical work. I think at this point, you could make a case one way or another. What's better, what's worse, and of course, like all the nuances on like who's it better for and why. So to me, like that question is just kind of a wash at this point. But like to your point, it's just there is just something different about the two different kinds of settings, the online setting versus the in-person setting. So I feel like to be like the best student, the best clinician, you need to experience with both. You'll have clients that will want the online telehealth model, and that allows for thriving and flourishing for them. But you'll have clients, I still get clients who are like, can we meet in person? And they want that as well because that kind of fits for them. So it's just I think you said it well. It's just a different kind of feel. And so you need experience in both those areas.
So many therapists only offer online too. So, I mean, it's changed so much with COVID. And, so the online also makes sense in respect to a lot of the therapy we're going to be doing is probably going to be online, even if we don't want it. it's, it's just the accessibility of telehealth. I'm in the same boat where I just have a few clients that are like, hey, can I come in person? But most of them are just so spread out and they're looking for a Catholic therapist. So they'd be driving 5 hours if they wanted to come in person. It's not realistic.
Father Burns is the president of St. Mary's University, and he's also a psychologist, which helps to understand why he wanted this program to be started. And when we were going back and forth about the online versus in-person kind of question, he's like, can you really like understand and like feel someone's like soul through like a computer? And I was like, see, that's the kind of question we can go about answering in our program. Like, I don't have an answer for you right now, but like the way our program is built, we can explore that question. Like, you couldn't ask that question in a bunch of other programs, I don't think, or you could, but you'd like risk the blowback that you would receive from it. But I was like, I love that question, Father Burns. Like, can a clinician like really empathize and feel and understand someone's soul through an online exchange?
No, that's such a good question. And I think we're still kind of grappling with that, just like as a society. Like, is there a difference? What is the difference? Like we don't think about that too much, but there definitely is, So that's really cool to consider. And I know that there's probably no smooth segue here, but I know we're kind of changing topics. But one of the things we talked about really jumping into today as well, and obviously it has to do with integration, is this intersection of priestly formation, which in a lot of ways is a pretty heightened integration of the faith and psychology and therapy, but the intersection of priestly formation and mental health. And so I know you have a wealth of experience with that too. And I would love just to talk a little bit about that today, because I've worked with seminarians and novitiates and religious orders, and even how you got into that. I don't know if you just being a Catholic therapist, maybe that's just the natural progression of how we get there. But yeah, what's your experience been working with clergy or seminarians?
Thanks for asking. First of all, like all my friends think I'm like terrible at cocktail parties because talking about like the priesthood and seminary and like seminary formation are like three topics that like I'm really passionate about.
Yeah.
And they're like, can you like talk about other things? Like, like
No one's going into the seminary
yeah.
here. Can we talk
Like,
about something else?
look around at this cocktail
Yeah.
party. Does it look like anybody wants to talk about like the seminary and priesthood? So I'm really grateful that you've broached the topic with me and we have some time to talk about it because I love it. It's such a big part of my professional passion and what I'm involved in. And of course, like when you're so invested in it professionally, really reflects like some personal discernment and calling and passion there as well. So in short, like I've been involved in like seminary formation as a psychologist for about like 13 years now. I do a bunch of evaluations for the applicants to seminaries. That's pretty much like the main bulk of my work. I've done some counseling with seminarians over the years, and then I sit on a couple formation or advisory boards in seminary and kind of offer a psychological perspective to things that come up with seminarians while they're in formation. So those are kind of like the three main areas of my involvement clinically. And then speaking of integration, I was like, I'm an academic full time. This is a bunch of clinical work. So I had to figure out a way to integrate my clinical work with my academic work. So a lot of my academic research and scholarship is about seminary and mental health, test results of these evaluations, and how to kind of best utilize the evaluations to make them tools for growth for seminarians.
I've appreciated hearing Dr. Peter Malinowski's emphasis like on personal formation. I know he quotes St. John Paul II a lot, but wondering if you could speak to that, like the need for personal formation for seminarians, clergy, religious. Because I think a lot of people would think about seminary or religious life, they can think about spiritual formation. And so even like, what's the difference? What's the point? Like why start with personal formation?
So I think there's like two dominant trends in seminary formation that when you have something so dominant, it creates like an imbalance. So like one of those was like really overemphasis on like the spiritual formation. So you had a bunch of guys that like could really pray a breviary really well and were like couldn't wait to get to like the next holy hour and say the next rosary, and all of those things, of course, are like very, very important for our seminarians to be engaged in. And we want holy priests. And so you have to like, develop holiness in the seminary. But that kind of came at the expense of like being more well rounded. And then the second overemphasis was then on the intellectual formation. Then you had a bunch of guys who were maybe like not praying because all they were doing is studying. They were like in the library, writing these academic papers, preparing presentations, and they just cared about what grade they were getting in all of these classes. So you had like smart priests, but they were like very like narrow-minded and bookwormish and kind of like with their heads in the clouds basically. And so psychology helps with that personal formation, which program of priestly formation written by the bishops call human formation. It's the idea that you need to be a mature man. You need to be able to be healthy. You need to be able to relate to other people. PPF has a great saying that I use all the time that a seminarian who is mature and is progressing in human formation becomes a bridge to Christ for other people. That was missing for a long time in seminary formation, or just really underemphasized a lot compared to these other areas. And so you had a bunch of guys that were either like super pious or super smart, but couldn't actually have a conversation with anybody. And that becomes obviously problematic when you're a priest and you need to be relating to hundreds and thousands of people, during a weekly basis who are all looking to you to be that bridge. And so that's a lot of what my psychological contribution is more in the human formation dimension.
I think it can limit like that pastoral sense too. Like you're saying, if there's not that ability to connect and relate to people, and for anybody who's doing their own healing work and even looking at like their attachments and their family dynamics and their wounds and their gifts, that helps them understand like, how do they relate to God as Father, right? How do they struggle, right? How do they relate to Jesus? How do they relate to the Holy Spirit? How do they relate to Mary? I mean, all those things are influenced by our personal human experiences, attachments, relationships. So even spending time with that, just, I mean, for anybody as a human, but especially as clergy or religious, to know yourself in that way is so big. And then I've really been impacted by priests, my spiritual director, religious, who are able to share their wounds in that pastoral sense to say, hey, I understand this. I've walked with you, and it's different. It's not the same, but like I can connect with you, on this human level. I mean, those are the people who have really impacted my life so heavily, and I have encountered priests who are just very heady, and I'm like, okay, this is great information, but sometimes there can even be dismissiveness of that personal or even that emotional experience that's hard because it could be kind of theologized away. There has to be this human element, and it's not replacing the theology or, the prayer aspect. It's
That's right. It's all
yeah.
complementary. Now, what the bishops call four dimensions of formation: spiritual, pastoral, intellectual, and human. And they're not like these standalone silos, but they're woven within each other to make a well rounded man that gets ordained to the priesthood. And I would say the good news is over the last, 13 years, I've definitely have seen a shift in at least the seminaries that I work with and the religious communities who are really starting to understand and appreciate and value human formation much more deeply. The church has really responded, I would say. You could also make the case that it was a little silver lining that came out of the pandemic because it was inescapable. The mental health and wounds and vulnerabilities that people experience because of the pandemic, where you just couldn't ignore them. They were just so palpable. Seminaries had to be like, we need to adjust in order to meet men where they're at right now.
My brain even went to, like you hear in the news or Catholic news, right? Like priests, spends however many thousands of dollars on like a game addiction, or things like that. And to me, that also kind of screams at this need of like, okay, that's a really personal, human issue, right? Like this addiction, so like, are we looking at these things, especially in formation before ordination or vows, to understand what's going on there? You hear things like this and you're just like, man, that's not, like you said, that's not a silo of like, oh, that's a spiritual thing, because we're body, mind, and soul. What affects one is going to affect the other. So we have to be considering these things with all the elements, all the aspects of the human person. So I think there's such a need there. And I'm debating whether this question is just for me, but to nerd out here about this dynamic, right?
Yeah, I think you have to ask it now.
I
Yeah.
do. Yeah, I do. One thing I've kind of encountered as a therapist working with seminarians is hesitancy on the part of the seminarians. And I know every diocese have different kind of protocols and religious orders have different protocols, but there can be a hesitancy of saying, I'm afraid of what I share in therapy as a seminarian could show up in a report. And I know that might be in the weeds, but I was like, I want to ask because like hearing that you like nerding out about this. So like that's have you run into that? And and I guess that's part of this question too, is like, how do seminarians comfortably pursue healing and therapy? Also, how do therapists navigate that? Because I know that's so hard, is like those in formation are kind of under a microscope at times with their human formation, spiritual formation. So
It's a great question because, the mantra might be, hey, let's get this guy some help. We have resources available. Go see a counselor. All that's good to say. That's destigmatize, counseling for seminarians. That's increase accessibility. But then there might be these backdoor policies like, well, we want your treatment notes or we want a treatment summary that could really make any reasonable seminarian kind of stop and pause, right, on accessing those clinical services. So I've seen kind of the range of policies. You have some great seminaries out there that have in-house counselors, and that really puts it on a whole nother level in terms of accessibility. But most of the time I do see that's attached to like a policy that, should something come up in counseling that warrants kind of a break in confidentiality, they have like a release form where the counselor would then go and, share something that comes up with like the rector or, whoever's in charge of human formation, what have you. Now they have the paperwork in place, it is informed consent. Technically the seminarian doesn't have to sign that. But then, like, if they don't, it's like a double-edged sword. Like, if they don't sign it, it could be like, well, they're resistant to our policy. What does that mean? So I feel bad for seminarians sometimes when they get caught in maybe like these tricky situations. On the other side, I know some seminaries who don't have like an in-house counselor. They have a nice referral network. And so then you're going to someone that's outside of the seminary system, which might decrease like the accessibility, but that distance can be helpful. That one step removed from the seminary system can basically allow for a tighter confidentiality when it comes to the informed consent and the sharing of information. But even then, I've seen some seminaries, set up like a signature kind of page to allow for some free flow of information. The seminary side of this is that we're paying for it. It's part of your formation. So if we're paying for it and in order to kind of form you to be a healthy priest, then we deserve some degree of is this working kind of information. Looking at it from that perspective, you're like, well, it's not the worst case in the world. Like I've heard worse arguments. It's not a bad argument. I can see it from perspective.
And therapy is usually not cheap, and the seminaries or the orders paying for this, and so it's like, hey, we want to know that you are addressing these things, and so there's a level of accountability there that makes a lot of sense. I've felt bad for seminarians at times who are even kind of saying like, hey, yeah, I would like a quarterly progress report for my rector or something like that, and maybe they don't always know like, hey, this could come up in a panel, in front of a panel, of people who are now reviewing you. And then they're kind of like, oh my gosh, what did I agree to? Even just that full understanding of like, what does this process look like? Or what information do you want, released to whoever? So that there's more ownership of that report. So there's sometimes where it feels kind of clunky or it feels kind of complicated. I think I find it's helpful just to have that transparency with the seminarian of like, and every seminary is different, but like, hey, this is kind of maybe how this is used, or this, so they have more say of like, what do you want in it? Because this is where it's going to go, type of thing. And this is your information.
That's the key, the transparency part. Absolutely. And like, what you said just a moment ago too, like giving them like some autonomy and agency in the process. Like, I don't know if you do this, but the clinicians that I respect the most will like share their treatment summary with the seminarian first and say, here's what, remember, like I have to like do a quarterly like report, like here's what I planned, like what do you think, here's what I wrote, and give the seminarian like a little editing power and a little heads up as well, and kind of, I think that's an important step.
And I mean, total side note, but even I'm hearing more of like AI being used where even like that there's that level of collaboration with like progress notes nowadays with certain therapists of like, okay, we're both seeing like what AI is, compiling with our notes right now, any edits you want to have. So I don't know where people stand on that, but I think there's a lot of room for collaboration even with these notes for clients. So that's something good for people to know, is like you can have actually a lot of say of, or even clarify things in your therapist notes, or ask for clarification, or if there's any questions you have. So
Yeah, I think the seminarian has a right to know what information is being transmitted to the seminary and who in the seminary has access to that information. And I think our professional ethics are very much in line with those rights.
that makes sense. And I think what I'm hearing, which is like a huge underlying theme, is just trust. Is, do we trust the formation committee or panel or director, like whoever this is going to? I think that's a really big piece of this. And like you said, it's like whoever's paying for the therapy is just wanting actually what's best for you, and wanting your formation and wanting your discernment, in this. And maybe there's a question here, but I think that really can be hard, is like for a seminarian to say, I'm sharing something vulnerable that maybe I am like addressing for the first time with anybody ever. And now I have this level of distrust or just fear or shame that I could be judged if this is known by whoever my formators are, but then even by other seminarians, right? It's like, that's huge. So yeah, if anything is coming up for you there, just like speaking to that trust in formation or community. I know that can be really hard for people in formation.
You're spot on. I mean, that comes up a lot. Trust, openness, vulnerability. When I sit down to write a psychological report from an evaluation, I'm writing it to like this collection of people who aren't psychologists. and who have like a lot of decision making power over the seminarians that I've tested. And so I have to be real careful with my phrasing and how I say what I want to say and how I communicate the findings, because any one of them can maybe pick up on one thing and maybe draw a different conclusion or interpret what I wrote differently than how I intended. And, that can impact the seminarian in lots of different ways. So I always have a feedback session with the seminarian. I go over the report with them, and so they know the information that's being passed on to the admission board or formation team, the rector, what have you. The other thing that I say to a seminarian or an applicant that's applying to the seminary each and every time is, like, you don't have to be doing this. Like, truly, you don't. Like, I know you feel called, and like you feel like you have to be doing this. Like, no one is making you go through this evaluation. No one is making you sign a release of information, to have it. So you could stop all this if you wanted to. Sometimes they just need like reminded of that. Like you have, like, they have ultimate decision making power over the information and the release of it. So then it comes back to like, well, if you truly feel called, like now we're talking about something supernatural here. Like if you do truly feel called, part of a calling is like some sacrifice and like submitting your will to what you feel the greater will here is in this calling. And that's not always going to be comfortable. That's not always going to feel good. I can't see anywhere in our Catholic faith where it says following your calling is a completely pleasurable experience.
What?
Yeah. So it kind of goes with the territory that there's going to be some awkward moments. There's going to be some challenges. There's going to be a deeper dive and a deeper commitment to trust. And that's part of following that calling that you have felt.
Yeah, and I feel like I've been blessed to work with people who really are transparent with formators, even to the point where we're talking about like, yeah, this is bringing up some shame, but they're risking what could be judgment to actually address what needs to be addressed. And I feel like I've been blessed to see that because the formators are usually very understanding and very compassionate. And so that's been great, is like, oh man, this is a moment of intimacy, right? Like in the formation process. And then in therapy, we are even just unpacking what, if there is shame coming up, like what is coming up, right? And or that fear of judgment, even if they're not actually being judged, it was like, yeah, I'm afraid of this, or I was afraid of this. And so that actually becomes a great opportunity to discuss those relational dynamics, which almost always mirror, right? Like childhood attachments. Like, what was dad going to say to me if I told him this? What was mom going to say? Or like, so I think maybe what's good to emphasize, if anyone's listening and is in formation or thinking about it too, or therapists listening, is just to even whatever's coming up in that process, or even within the protocol, right, of a therapist working with formators, that is so important to bring into the therapeutic relationship with your client, to say, hey, how is this affecting how we work together, or what's coming up as we do this work, and as the formator is getting a progress report or whatever that is. Like, that seems so essential, like, because it could be easily ignored, like, oh yeah, it's just a policy, but it's like, no, what is actively coming up as we have to write a progress report? Like, what is this stirring in you about being seen?
I've seen a lot of like just relief from seminarians once they do kind of cross that threshold into trust and openness and intimacy. They're like, they've built up this like expectation of like judgment and shame, that has like prevented, disclosure for such a long time. And like once they like finally, break through that, they're like, oh, like that wasn't so bad. um, between, me, a rector, vice rector, years of counseling, doing evaluations for the priest, years of hearing confession, pastoral counseling. There's very little we haven't heard yet that would like shock us at this point, you know? So we have like a pretty good idea of what's going on. And we're just kind of waiting for the seminarian to be open with us. It's one of those things where once they do, they're like, oh, like, boy, like that wasn't, I can't believe I built this up so much in my head all for all this time. And yeah, I'm lucky like the seminaries and religious communities I work with, very psychologically minded, very pastoral in their approach. They really do want the best for the seminarian. They have the seminarian's kind of heart in mind whenever they have these discussions. I have never seen like an I gotcha kind of moment or, you know, coming down hard on a guy for a difficult disclosure. It's always been met with like understanding, care, compassion, and then, all right, like, what can we do, like, moving forward here? What resource do you need? What support do you need? What's the best decision for you at this point? I can definitely attest to that in the seminary system.
Yeah, that's great. That's a great reminder. Like, if you're afraid of an I gotcha moment, or if anyone experiences that, it's like, that's like the antithesis. It's priestly formation, right? That would be a whole different issue, right? It's like the more like the vast high majority of formators are like, I want you to flourish. I want what's best for you. I want you to understand God's calling for you. I want you to be healthy and holy. And so it's not a place for shame or judgment. I remember I was doing a CEU recently. It's more geared towards like law and ethics, but it was a great reminder because the presenter was saying, it's like, yeah, you know, if you have to fill out like, I think it was a child abuse report, but it was some clunky report, or actually maybe it was just going through the informed consent. And they were saying, they're like, yeah, you know, if every time you review like informed consent policies and what therapy is about, like that is a therapeutic intervention. And I was like, huh, wait, let me rethink that. And they're like, yeah, anytime you go through protocol with somebody and you're just talking like, what is it like for you to know like, hey, this is, you know, an exception to confidentiality, or how does it feel knowing that this, you know, this report's going to be made or whatever it is, like that is really slowing down into this relationship with your therapist and acknowledging what trust is there, what trust isn't. Same thing with your rector, whoever your formator is. That's actually a really huge part of the process to recognize. And it's not just a formality. I know a lot of seminarians can feel like, especially if they're recommended to do therapy, that therapy is like a checkbox on that formation checklist of like, I'm going to keep moving up. I don't know if you have any recommendations for seminarians, you know, or anybody in formation who receives that feedback of like, oh, okay, I have to do therapy. To have it not just be a checkbox.
Yeah, I've seen that. Of course, we know that a therapy works the best whenever the client comes in with intrinsic motivation for change. And so a mandate can really decrease that intrinsic motivation with seminarians who are kind of in that position. And I've seen them. I'm like, well, you're here. I'm here, and or whoever the therapist is, like, what can we accomplish under these circumstances? You know, anything, you know, and you just kind of like try to bridge that gap with the seminarian. Sometimes, you know, my consultant role to seminaries, like I'll be honest and say, you know, not every guy needs therapy either. Like, or therapy isn't the intervention that's going to enact the change that you want to see with the seminarian, you know? So it isn't some one size fits all, going to help all intervention. That's the kind of the other piece too, is like maybe the seminarian has a point. Like he doesn't need to go to therapy and he's not going to get anything out of it.
Yeah, for sure. And therapists don't want to feel like they're doing court mandated therapy.
Right.
Like I've been there, you know, I've done the court mandated stuff, and there's a feel, right? So it's like pulling teeth, and so I think even unpacking that in therapy is like just to be honest with your therapist, even if you're like, yeah, I feel like I'm forced to be here. It's like, that's great. That's really good to talk about. And like you said, like maybe this isn't for them, or maybe it is, and they, you know, even just to explore like expectations for therapy, like how can this help you? Like if you don't want to feel forced, like, yeah, I don't want you to feel forced either. What would be helpful? Because this is your time, you know, your therapy. So that again, that ownership, I think, is is big.
Yeah, and I'll often dust off that saying again, like, "You're in control here." Like, you don't know, like, you are kind of mandated to be, but you're only mandated insofar as that you're choosing to be in formation. So you don't have to be, and kind of give them that kind of quandary, well, kind of mental quandary to kind of work through again. Some guys are like, yeah, like maybe I'm not called, or some guys are like, no, I am really called, and if my formators are telling me I need this, I need to like basically brush up on my obedience here and see what I can get out of it. That's the leap of into maturity that you're hoping to see from a seminarian, and quite honestly, like an indicator of whether they're truly called or not to the priesthood.
That's good. Yeah. That's kind of the why, right? Going back to the why. Like, hey, wait, why are we doing this? Like, why do you want to do this? Yeah. And if so, like, okay, so like what's the point of this? And I guess kind of a question I would have too would be, do you have any words of wisdom for seminarians who, yeah, might be resistant, like you said, to that obedience or to that ask of, hey, you should start therapy? Anyone who's maybe hesitant on the personal formation side, any thoughts on why they might want to consider it?
Well, I think, when it comes to like seminarian and priestly health and well-being, so much of the public attention gets kind of shown on the celibacy part of the priesthood. Like people could talk for hours about celibacy and have very strong feelings about it one way or another. I think lost in all of that is obedience, and that promise of obedience. I have seen that be just as difficult, if not more difficult, for seminarians than the celibacy promise that they're working on as well. Because obedience kind of really taps into and disrupts our kind of masculine nature to maybe like be a little bit more stubborn, a little bit more defensive, prideful, whatever you want to call it, or try to do things our own way, be independent. And so we also have like a kind of a subgroup of seminarians who come into seminary after being like doctors or lawyers successful in life. And they're like, well, I'm just going to bring all my strengths into formation. I'm so good. Like I'm a real gift to formation, which of course they are, but like they still need formed, right? And under the guidance of formators and under the promise of obedience. And so it's such like an under discussed part of formation and the priesthood, especially compared to like the other kind of promises of like celibacy that are taken. But it's something that I've seen a lot of guys really struggle working through. My advice, I think, ties into a lot of the themes that we've talked about already. Like, your calling is going to be judged or assessed through, your capability to be open with these formators, to be honest with them, to show them your strengths, but also show them your vulnerabilities as well as like your capacity to kind of work on those vulnerabilities as well. You can't hide any of those things in formation these days. And so if you're going to really pursue your calling, you have to embrace that part of it under the guise of obedience, under the assumption that these formators are here to help you in all of those areas.
That one word, obedience, has so much behind it. And I think just like from a secular perspective, like that is such a bad connotation these days.
Yes.
Like be obedient, like, excuse me. But then going back to trust, right? It's like to be obedient to a father or a mother, to become childlike again, as Jesus is calling us to do, to trust our spiritual fathers and mothers. I mean, that's really it. Is not like we just want you to be submissive for the sake of power or control. That's kind of how the world views it. But it's like, no, there's something deeper here where we want what's best for you. We want what's best for your heart. And that trust is so key. So I guess too, I'm just hearing like if that trust isn't there, right? Or there's questions of that trust, so that's so important, even in the therapy process, to say, yeah, what's coming up for you with like your rector or your formator? You're like, is that if that's not there, it could really feel maybe even oppressive at times. Of like, I just have to do this, and I don't want to.
You've used the word attachment a lot in our conversation. I think that's a great word as well. Like, if you know attachment theory, a secure attachment is what builds or the foundation for trust. And so formators that I know, they probably don't use attachment language, although some of them do, not all, but they understand that they have to build rapport. They have to build trust. They can't expect a seminarian to be open and honest and then have like be punished for that on the other end of that, like open and honest disclosure. So they know that they have to have like a secure foundation for that information. And so those are the real skilled formators out there that are attuned to the dynamics and involved in those relationships and those disclosures and have the best intentions in mind whenever they're working with seminarians. I'd like to say that every seminary has a seminary full of formators who are 100% on board with that. That's not the case. It's not a perfect system. Not every formator is perfect. So I know there's some horror stories out there among seminarians. And so want to acknowledge that as well, too.
Yeah, ideally, right. It's that everyone's kind of aware of, their own wounds and potholes we might step in, and even formators, right, are kind of addressing their own trust issues or how they navigate these difficult conversations. Ideally, yeah, no one's perfect, but it really does come back to even that aspect of faith or trust of like, hey, I had a bad experience with this person, but again, why am I here? And what is the bigger picture, and where are those people around me that I do trust? I really can say, okay, this is that, secure, like fatherly or motherly attachment in my journey, my not just spiritual journey, but in life, where I know that God is still working, even if maybe this person, it did feel like punishment, right? Whether or not they intended it to or not, that could be a different question. But can I come back to that why and see where the Lord is working in this process? I think that's huge.
One rector I work with has been a rector for a while now, longer than any other rector I've worked with. And so he has the art and the science really down well. And he started a joke with me recently. He's like, whenever I first started being a rector some years ago, like it was such a big challenge to get guys to open up, the authority dynamic, the father wounds, the attachment, etc. He goes, now the guys come into my office, sit down, and they're just like, like here's everything. So now he's talking about like boundaries, like appropriate disclosures, like
Got it. Yeah.
how
Yeah.
much to disclose and when, I was like, well, that's just such a testament to the work that you've done and your reputation that the pendulum has swung so far the other way that now you're kind of teaching like some advanced meta skills to the seminarians, based on how you've lived out your calling as a rector.
Yeah, that's a good problem to have as a rector
Yeah,
for me.
exactly.
It's like, whoa, like too much, right?
The
And
guys
yeah,
are too
teaching that
too honest
prudence.
and open with me.
Yeah,
I have to
they
like
trust
rein
me
it
too
in
much.
now.
Yeah. It's just that prudence of like, okay, maybe we don't need to hear all that, but I'm glad you're just, transparent. As we're wrapping up here, well, I guess kind of two things, like, or maybe three things, but any last thoughts on these kind of formation dynamics? I know we're also talking about faith integration in general, but also where can people find you if they wanted to reach out or had questions? So I know that's maybe a lot, but last thoughts, and where can people find you?
People can connect with me through LinkedIn. I'm very active on LinkedIn. I'm happy to connect with you there. I post a lot of things on LinkedIn. I'm on St. Mary's website and have obviously a St. Mary's email address. People email me. I'll put in a quick plug for if you're interested in this topic of like seminary formation and things like that and how everything's going. The National Catholic Register has run quite a few stories over the last couple weeks about kind of the state of things in seminaries in the United States. And there's been a lot of good news in terms of some of the things that we're talking about, but you get it from some theologians and some rectors who kind of talk about it from their perspective. And Georgetown has a statistical arm called CARA, and they publish a lot of church statistics. So this summer, they published a report on like vocations and numbers and things like that, which was really interesting to think about. Where are vocations up? Where are they down? What are some underlying reasons for both the ups and the downs? And that report and that data, it's on the internet, of course, you can search for it, but it also served as kind of a springboard for those National Catholic Register articles that I was referring to.
Thanks for sharing all that. That's great. And yeah, and it sounds like if people have any questions for you or about St. Mary's program, they can reach out. And you guys are starting
September 2nd is the first day of fall semester. So that will be our first cohort. We're looking to have, way things are looking right now, probably about 15 new students starting in the fall. And then we'll be accepting a new cohort for the spring semester in January. So would be happy to answer any questions you have about the program.
Well, thank you for all you're doing in faith integration with counseling and psychology. And I love seeing, the things pop up that you're doing. Like, I think I saw a couple years back, like Word on Fire interview article that you did, and Integratus, like everything that you've compiled over the years. So thanks for all these resources that you're sharing.
Yeah, you're welcome. Just trying to do my part out there,
Yeah. And thanks so much for being here today. And for everyone listening or watching, thank you so much for tuning in. Feel free to leave any comments below, or give this video a share if it's of interest to you. But yeah, thanks all for watching again, and we'll see you next time. God bless.